Mr. Crisp and I were asked to come and present to the city of Bristol and just on a building project they had going, so we had the opportunity to meet there. And then, so since then, I've directed students his way. But we've had, Kara Dibble went to Dominion, which is the company Josh is with. Had an excellent opportunity there with her field experience. We had another student go to Broadmoor in Johnson City. But there are growing opportunities for assisted livings and opportunities for students in that setting. It's something that this is what Josh is going to talk about, but it's something that you can get into as an undergraduate or as a graduate. So, Mr. Crisp. He's been in I see 11 years in the industry. Is that correct? Yeah. Bill, and currently with Dominion Senior Living since 2014, and in that role specifically over construction, and the company is going to double in the next year. So there's a lot of growth in that industry right now. Josh also serves on the licensing board for long-term care facilities. I should know that. I have to deal with it all the time. You're the chair of that committee. Chair of the assistant living committee. So he was appointed by Governor Haslam to be on that board at the state of Tennessee. He also serves on the advisory committee for the college and the department as well. So we are very blessed and honored to have him here today, and I'll turn it over to him.
All right. Well, thanks, Colin. Generous introduction, and just call me Josh, Mr. Crisp. Sounds really old. And just so you guys know, I am not probably your traditional lecturer, and I was asked to give a lecture. So this morning, I hope that we have more of a discussion. I left a lot of time at the end of this to allow you guys to ask questions. And they even mentioned that after this, there might be another class coming in, but that we might go next door. Anybody that wants a little bit more information about how to get in the industry or get plugged in, I'm happy to stick around. And then I can skip town after that. But kind of the purpose of what I wanted to do here today, as you can see, it says Discover Senior Living Issues, Trends, and Careers. I really want to give you kind of like a 30,000-foot view. I'm not really sure with all the different backgrounds and what all you're studying, how familiar you are with specifically assisted living is what we're going to talk about today. But we may touch on a couple other areas. But the 30,000-foot view, and from there, if there's specific things you want to dive really deep in, we can certainly do that. I love talking about it, but I don't want to inundate you with too many details that may or may not be relevant to you. So we're going to get started here, and let's make sure this is working. Green button? No, that's the pointer. Hey, there we go. That's me. All right. So there's my contact information. I'll give this to you again later. So let's move right on. I did want to share, as Colin touched on with you all, I know this is a success story for probably ETSU and for Kara, but it's really a success story for us. Shortly after I met Colin back in 2014, we had a construction site underway in a community getting close to opening right here in Johnson City. I'm not sure if you have seen Dominion Senior Living of Johnson City. It's over on Knob Creek, kind of close to the state of Franklin. A lot of people don't think it's a senior living community. A lot of people think it's like a nice apartment complex or condos or something, which is a good thing, right? So we're trying to change the culture a little bit. But Colin approached me about us being part of the Intern program. So I was really delighted to do that. I've done that in multiple different markets in different states. And so he introduced me to Kara. I don't know if any of you all know her. I think she graduated in 15 perhaps last year. I think so. Yeah. So she interned with us in that spring semester. And for Kara, I wish she was here to tell you all a little bit about what all she was thrust into. But she did an awesome job. So she was assigned to really shadow and work alongside the assisted living administrator. Thank you. At that community, and she came on right at the point where we had about 4 months leading up to opening that community, which was a really crazy time. I won't go into everything that goes into opening a brand new community, but we brought on about 50 staff during that time. We were finalizing all of our policies and procedures with the community, going through our licensure inspections, our life safety code inspections, $300,000 worth of furniture arriving in boxes and different things that she was on her hands and knees assembling, so not everything was glamorous by any means. But she stepped to the plate, actually did some wonderful things in helping us to develop some policies and procedures specifically around transportation of our residents and things like that. So she did an excellent job developing training programs for that. So a really good success story at how I think ETSU is equipping you all in kind of your, what I would say, critical thinking in how to solve problems, because in my world and what I do in assisted living, there's no just formula to teach you how to do it. You've really got to dive in and use your critical thinking to get there. So fast forward just a little bit more, Kira, at the conclusion of her internship, at least what she shared with me, she kind of just fell in love with the industry, the community, the residents that were moving in and working with the team, and she just wanted to be part, and she was looking for a job after she was graduating. So we really didn't have a specific job for her, but we gave her a job without a title. And so she came in at the most entry level, and she was literally working in our kitchen some, she was serving meals, she was doing some housekeeping, she was helping with activities, she was doing tours. I mean, you name it, and Kara was doing it. And so that work ethic was very attractive to me. Nothing was beneath her, but she was also, when she needed to be polished and professional, she stepped up to the plate. You can see here, I have no clue what they're drinking, but that doesn't really matter. But you can see that look on Kara's face is kind of what we see all the time. She's always smiling, a joy to be around. So she had an opportunity as our population was growing. We've almost filled up that community, and it's only been open for 5 months. So that's about 18 months ahead of the industry average. So that tells you something about the demand for those services here in the Johnson City market. So Kara moved into what we call a Life Enrichment Director assistant position. And that's Life Enrichment, as you may have heard, more of a popular term for that is Activities Director. So she became the assistant, planning and organizing all of the activities socially, physically, all those kind of things that go on for our resident programming in the building. And just recently, she was promoted to the Life Enrichment Director. So now she's director position in less than 6 months of working with us. So she's definitely on the fast track. I don't know what the future holds for Kara, but I know it's bright, and pretty much whatever she wants to do, she's going to be capable of doing. So I think that speaks to how you guys are being equipped here. So I'm really excited for you, and really excited for Kara. So we'll move on here. That just tells a little bit more about the details about Kara. So what is assisted living? As we'll talk about how assisted living is regulated a little bit later, how assisted living is defined is kind of a moving target because it is regulated in all 50 states, and it's all regulated a little bit differently and therefore defined a little bit differently. But the Assisted Living Federation of America, known as ALFA, and just the brief summary of who that is, ALFA is a lobbying organization, a networking and organizational and professional membership organization for assisted living. They predominantly have membership consisting of assisted living organizations that are for-profit. There's another arm known as Leading Age, which I'll tell you more about later, that kind of handles most of the nonprofit assisted living. But this is the largest trade organization, member organization, and they typically use the standardized terms that we do. So kind of a long definition here, and you can see they define it as assisted living as a long-term care option that combines housing, support services, and health care as needed. Assisted living is designed for individuals who require assistance with everyday activities such as meals, medication management, assistance, bathing, dressing, transportation. Some residents may have memory disorders, including Alzheimer's, and they may need help with mobility, incontinence, or other challenges. The residents are assessed, and from that point, a service plan is developed, often known as a care plan. You guys may have heard of that. And the residents' needs are met. I would make one comment here. This is a very accurate definition, while it is a little more lengthy than what I would like to define. It says that some residents may have memory disorders. that's really a huge understatement. Now, even in assisted living, even if the residents aren't in a secure memory care community within the assisted living, over half of the population, most studies have shown, in an assisted living have some cognitive impairment, some form of dementia, but they're still able to, get around mostly just with some additional assistance. So that is how it's defined. A few more statistics. It is considered a residential alternative to nursing care. According to the National Survey of Residential Care Facilities, there are over 31,000 assisted living communities serving roughly 1 million seniors. I wanted to bring that down to earth for you here in Tennessee. I'm not sure, I'm assuming a lot of you are from Tennessee and you may be entering the workplace in Tennessee. But this is statistic through December of 2015 from the licensure board that I serve on. And you can see in nursing homes, 319 total licensed facilities in the state of Tennessee, representing a little over 36,000 beds. As compared to assisted care living facilities, you can see there's 278 licensed facilities, representing a little over 17,000 beds. So a couple things you could gain from that. One is, yes, there are more skilled nursing facilities and nursing homes out there than assisted living right now in the state of Tennessee. I wish I would have put together a model to show you the trend over the last 3 to 5 years. And if I showed you that on like a chart, a graph, you would see that probably within this year, assisted care living facilities will outpace and there will be more of them in the state of Tennessee than there are nursing homes. So the industry is rapidly growing. There's a lot of reasons for that we'll discuss again in just a little while. Another thing you can glean from this is proportionately, if you look at those numbers, in most cases, you'll see that the average size assisted living community has about 60 beds. And the average size nursing home is going to be over 100 beds. So again, that kind of alludes to the more residential style, the more community feeling, and that's the inference there. The industry began roughly 25 years ago, and it was mainly a hospitality model. When I got into this, and I'll tell you all, I wasn't probably as driven as you all were to find healthcare. I didn't have a clue when I graduated what I wanted to do. I was working 3 jobs and just got married and had a kid on the way. And I was just trying to make ends meet, and I just happened to stumble into this world of assisted living when somebody asked me if I liked old people. And so I said, yeah, I like my grandparents. So that's where my world started in this. So you're way ahead of where I was. I'm just trying to tell you that 11 years ago. But when I got into it, I started working and became a licensed administrator in a Texas facility, and I was living in Knoxville. So you can imagine I was basically living in the community and flying back on the weekends to be with my new bride. You can imagine that was not a great atmosphere for me at home when I got home. But I'll tell you, at that time, even only 11 years ago, the industry has radically changed. It was almost completely a hospitality model. We were getting our training and so forth from Ritz-Carlton programs and things like that. And really all that we were providing was some supportive services. So for instance, on medication, on that issue, we would simply come in and our staff would remind people to take their medications. The world now is we're actually giving people, we're administering medications. So just in that one area, you can see the paradigm has completely shifted. Assisted living continues to expand in the healthcare continuum due to many factors. We'll talk about these legislation, changing reimbursement models, and so forth. Assisted living today is very much a combination of hospitality in the residential setting, but all of the assistance with healthcare needs, it's become very much part of the healthcare delivery system, even though it's not part in most states of a reimbursement model. So, a few resident demographics. You might ask, well, what does the population look like that you serve in assisted living? Here's kind of the average. And again, according to Alpha, who keeps a lot of our statistics. More than half of the residents are over the age of 85. You can see I did some analytics for you here, and this wasn't much different than in my previous company I worked with for 9 years to build. We have our average resident's an 87-year-old female. So obviously we have folks younger than that. We have folks older than that. I have a gentleman in one of our communities in Sevierville that's 102 years old, and he still talks to his broker every single day. So, that gives you an idea of what we deal with. I've also got a gentleman up here in Dominion Senior Living of Johnson City that is 55, and he has some issues that just require him to need assistance cognitively. But actually, if you were just talking to him or just saw him, you would think that he was your dad or someone just walking down the street. So a big spectrum of what we care for. So this is an interesting number. According to national studies, the average length of stay, which is a big number for us in the industry, is 22 months. So the average resident, they live in an assisted living community for 22 months. What happens after that? That could be maybe they move to a nursing home because they need more care. They might go to a residential hospice. They might pass. There's a variety of things, but for whatever reason or reasons, it's about 22 months. Interesting about this, when I got in the industry, assisted living average length of stay was 24 months. So just in the last several years, that has dropped. I think that speaks to a lot of factors. But mainly the acuity that we see now, not only that's entering our building, but how long they're staying. So the philosophy, big picture of what we strive for in assisted living is, as you can see, right now, and really has been over the past 2 or 3 years, and it's probably this way a lot in nursing homes as well, is the concept of person-centered care. That centers around resident choices, patient choices. They're having a lot of dignity and privacy in what they choose, who they choose to care for them, and how they're cared for, dining options, when they wake up, when they go to sleep, when they get to do transportation, what activity programming they have, those sort of things. We encourage dependence, as I said, freedom of choice. It's a huge partnership with families and providers. That's probably one of the biggest things and most impactful differences of assisted living. It is residential style. And then I wanted to point out, this has been an ongoing trend over the last several years, and it's an aging in place model. There's actually legislation, and you'll have to forgive me, I don't remember the name of the legislation, but several years back that was passed in the state of Tennessee, and similar legislation has been passed in other states, to allow a resident to remain in assisted living longer than what traditionally the facility, the community was really licensed to and equipped to care for. In other words, prior to this, what would typically happen is when a resident got to a point, let's say, with ambulation or transfers, that they could not transfer themselves to and from an assistive device, if they couldn't get themselves out of the building with very little assistance, that would be one of the triggers that would say, hey, this resident needs more care, we need to get them into maybe a nursing home or another setting. Well, once the legislation passed and then rules came into effect with the state, then it said, hey, if a resident gets to that point, if you follow plan A, B, and C, and the interdisciplinary team, I don't know if y'all ever heard that term, but an interdisciplinary team in assisted living is a physician, a nurse, the resident, a family member, and the administrator, and usually a social worker. If they determine that a care plan can be put in place, a service plan can be put in place for this resident's needs to safely be met in the community, all agree that everything's being met, then that resident can live out in that community as long as they want. So that is a big thing that is impacting how we create models of care in assisted living. And that was kind of a game changer for the industry. Common amenities, and these are just scratching the surface. More and more amenities are constantly being added. You can see meals served in common dining rooms, 3 meals a day, 7 days a week, 365 days a year. It's like running your own restaurant. And so like at Dominion of Johnson City, you know, I've got about 75 residents eating in there, and they all want to be served at the exact same time. So you can imagine when you filter into a restaurant, you're gradually being served. I've got 75 residents with their forks on the table at noon, all wanting food at the exact same time. So challenges you have to work through in assisted living. Transportation service. They're going to want to go, many of them, whether it's cognitive, physical impairments, they can't drive any longer, but they still want to be active. They want to be out. They want to be engaged. So we have handicap accessible transportation vehicles, and it's a real logistical feat getting these folks everywhere that they want to go, from social outings to doctor's appointments and hair appointments and grocery stores and shopping and things like that. Exercise and wellness programs is usually a huge part of every community. We also coordinate in a lot of therapy services. The community in Johnson City here actually has its own therapy department that we staff with a management agreement with a therapy company. So they're there every day doing exercise and wellness and therapy programs for our residents, almost like an outpatient rehabilitation center. Laundry services, social activities, theme spaces and activity areas. If I showed you a lot, and we don't have time today, some of these communities that are being met, they're built around themes, and they're made around special interests. So, and it all depends on the market and what they're going after and what seniors they're trying to attract. That's just a snapshot of amenities. So here's some of the personal services, some of the things that we assist with in assisted living. Eating, bathing, grooming. I won't read all these for you, but I will tell you one of the biggest issues right now for a lot of reasons is the medication management. That's one of the most popular things and reasons why residents come to us in assisted living. And if you imagine several of you are involved with grandparents or maybe even aging parents. And, well, even myself, I look at all the vitamins and some of the medicines I take. Sometimes I'm like, I don't know what time to take all this. But, for instance, my grandmother, before she moved into assisted living community, we were checking on her all the time. And she had about 20 different medications that she was taking at all different times of the day. You add a little bit of cognitive impairment to that, and it can be a real disaster. So what we see is a lot of folks coming to us that they need not only assistance in just reminders, but they actually need assistance in ordering, getting that packaged, getting it delivered to them, assisting them with taking it. And now I'll just touch on this because this is a really hot topic in Tennessee. As a matter of fact, Wednesday, I will be in legislative meetings all day long because there's a real battle going on in the state as to what assisted living and nursing homes can do as it relates to administration of medication and what staff can be certified and licensed to do administration of medications. And to kind of boilerplate that for you, because if you're entering, you'll hear a lot about this in the coming months and years. But in the state of Tennessee, every state, usually the nursing board, they're the ones that define what constitutes medication administration versus assistance with medication. And without getting into those definitions, in the state of Tennessee, we have a very broad definition of what determines or what constitutes med administration. And we have a very narrow scope of what can be considered assistance, which means only licensed people right now in the state of Tennessee can administer medications. The implication there, to just fast forward for you, is that because of the rising acuity in our industry, what assisted living is having to do, even though as per the regulations, we don't have to have nurses on staff, if you can believe that, in assisted living. We just have to have access to nurses, which means it could be a consultant, it could be an on-call nurse. In reality, over the last 3 years in particularly, if you go to like Johnson City, into my community, you'll see nurses on the floor staffed 24/7. And it's because our acuity has risen so much. Medication management and all these other areas are requiring much more skill set. And the way that the state in Tennessee defines that, only a licensed person can perform a lot of those things. So there's this movement in a lot of states that are already progressed ahead of Tennessee in many areas as it relates to healthcare, to allow people to get certified to do certain tasks that are somewhere in between maybe a resident assistant that's uncertified, or even in between a certified nursing assistant and a licensed nurse. There's a big gap between those two. And so there's this movement to create training and career pathways to where you can train and equip people to do certain tasks. Yes, sir.
So one of the trends that we saw in the SNP was that our acuity rose, and we really kind of became the hospital 20 years ago. Are you feeling like assisted livings are becoming the nursing facilities of 20 years ago, where they used to? I mean, they called them walkie-talkies. People would be out and walking and talking. Now, SNFs are high acuity, multiple comorbidities. They have, there's physical therapy, occupational therapy, medication administration. I mean, all these things. And from what I remember hearing from some of my folks that have been around for a long time, it sounds like this is becoming what it used to be.
It is, absolutely. And I don't think anyone in the industry would argue with that at all. The challenge is the acuity that was previously in the nursing homes, for a lot of factors that we may touch on here in just a minute. For a lot of factors, economically, legislatively, reimbursement-wise, that acuity was pushed down the stream to assisted living. The challenge is assisted living, the law that regulates us and the regulations haven't caught up with that. So we're kind of stuck in this model of, wow, we have all these really frail people that we need to care for, but we're not licensed to care. So they really have become care coordination centers. So,
do you think that the reason there's hesitation for regulation is because they don't want to put the assisted living into that reimbursement model? And what I mean is Medicare, Medicaid. Do they want to? Are they trying to? Do you sense they're trying to keep you out of that so that it stays private pay as opposed to Medicare, Medicaid reimbursing for that?
I think common sense would tell you that they're trying to keep us out. I think they're trying to get us in.
Okay.
And people in my position are trying to keep them out.
Oh.
So and that's a long topic that we can have, but we can talk short version of that. But yes, and I actually predict probably within the next 3 to 5 years we will be part of the reimbursement flow. We're already seeing it with Medicaid in different states. The challenge is with the industry being state regulated and not federally regulated. It's hard to create standards of practice, and it would be very difficult unless the federal government really took over regulating assisted living for them to incorporate us into that fully. But you're absolutely right. I mean, some people may feel that way, that there's a resistance, they don't want us. I feel just the opposite. I feel like their claws getting into us a little bit more all the time, and I think that's where we'll head. So we'll move right along. So just what I was talking about, state regulated. We are regulated in all 50 states, and it's kind of a two-edged sword. Kind of with every positive, there's also a coinciding negative of that, right? I'll just touch on a couple of them, and your common sense you could probably think of some others. Some of the difficulties, just what we were talking about, standards of practice. Over the last 11 years, I've been, I guess, fortunate in many ways to be part of and helped companies grow. I took the first company from one facility in Texas, one community, to over 6 communities in multiple states. And it becomes really difficult when you're not only constructing, developing, but really when you start managing communities across state lines and what works in Tennessee, and you've got your standards of practice and your policies and procedures, and these residents are well taken care of. You go to Alabama, you go to Virginia, you go to another state that's even neighboring you, even Bristol. It's like I'm building a community there, and what works on one side of the street I'm not allowed to do on the other side of the street. So that tells you how difficult, from a business standpoint, from an operator standpoint, how difficult it can be, and that oftentimes is a disadvantage of being state regulated. Industry statistics are inconsistent and skewed. This is a real disadvantage, especially on mornings like this morning when I would love to be able to give you a lot of great statistics. It's hard to find consistent statistics because every state's regulated different. You've got all these different associations like Alpha that all have their own set of statistics, and they're all skewed to some degree. So you kind of have to take just trends within the statistics. And it is difficult to operate in multiple states. So we've already touched on that. Some of the benefits, again, two-edged sword. Less regulation provides more flexibility for providers to deliver creative and affordable care models. I can tell you the assisted living industry is the most equipped and the most able to adapt to all these changes. When there's a upstream, as I call it, when there's changes in the reimbursement model and there's changes in federal regulations, and it's taken so long for the law to catch up with regulations and things like that, and the nursing homes are struggling with that. There's entrepreneurs and there's business people, there's folks already in the industry, and we can move really quickly because all we have to deal with is maybe a state entity, and the regulations are usually a lot less stringent. So that's one advantage that we have. Lower overall cost of care to consumers. This is really interesting. I was really shocked when I got into the industry. Everybody, I think assisted living, and I don't know if y'all have gotten this or not, but everybody thinks, man, I can't afford assisted living. How could I possibly afford assisted living? It's so expensive. I think some of that is just the sheer aesthetics. When you look at a nice place like Dominion Senior Living of Johnson City, and then you go down the road and you might see a nursing home that's 15 or 20 years old, very clinical, institutional feeling. Well, it might surprise you. We'll talk about that in just a little bit, about the difference in the cost, and I actually have some averages that will probably be shocking to you on cost. But further on regulation. This is really interesting. Every state, like I said, is regulated different, and the entities that they have set up to regulate are totally different from state to state. And it's really difficult, as if you go in and you're an administrator, it's very important if you get that role, or even no matter what you're doing in assisted living, the regulations that are enforced upon you and that you have to operate within all come in Tennessee from right here. And this is a very simple explanation of it. But here in Tennessee, there's the Board for Licensing Healthcare Facilities. Colin mentioned to you earlier, I'm on that board. Every 4 years, board members are appointed by the governor for 4-year terms. Now, you can serve multiple terms. There's many people on the board that have been there probably as long as I've been alive. But typically, it's a 4-year term. There are 18 seats. So in the state of Tennessee, all healthcare facilities that are licensed, everything rises and falls with this board. Licenses are issued. If there are problems, we have official hearings to revoke licenses. Unfortunately, sometimes we have to shut down health systems. We just did that recently in an emergency board meeting. But there's of the 18 seats, there's only one seat dedicated to represent what we call assisted care living facilities and residential homes for the aged. There's not very many residential homes for the aged in the state of Tennessee. It's a model that's kind of right underneath an assisted living, and there's not much different in the regulations, except that assisted living is just licensed to do a little bit more. So we're seeing residential homes for the aged kind of wither away a little bit, but there's physicians, there's pharmacists, there's home health nurses, there are community representatives just that aren't involved. They're maybe retired and they're representing the consumer on this board. Also on this board, there's 4 standing committees, and the standing committees are really like the workforce of the board. So I'll try to remember them all. Obviously, there's the Standing Committee for Assisted Living. That's my committee that I chair. There is a Performance Improvement Committee. There is a Facilities Construction Committee, and I think the 4th one is the Education Committee. So really how it works is when issues are brought to the board, to our publicly held meetings, typically before that board meeting has occurred, the standing committees have been working behind the scenes to interpret guidelines, to create rule language, to make ruling recommendations to the full board, and we vote. And then whatever that board determines by the majority is what happens here in the state of Tennessee. So we don't make the law, we interpret the law, and we write rules that regulate based on the law. Does it make sense? So that's the very, very simple version. And so you can see in the state of Tennessee and then other similar organizations, that is a very influential source that you need to get to know, you need to get involved with. That board, and I'll just kind of put in my 2 cents here, it is a board where, due to a lot of conflict of interest and sunshine rules, we can't be involved out in a lot of rallying and things like that. And when things are brought to our board in this public setting, we're really dependent on the people that are there presenting and lobbying and telling us what the consumers need and what providers need and things like that. And you'd be surprised how many people don't come. And so I tell you that I would encourage each of you, if you're getting involved in any kind of a licensed healthcare facility, to ensure that your organization is really involved with being in front of this board, because we need the feedback to know what the consumers need, because the needs are often a lot different in a market like Johnson City versus a market that is more rural. And so when we, through our narrow lens, are making rules and interpreting language, sometimes we don't get it right. Okay, that's just the way it happens. And so we need your input on that. So what's the cost? Before I break down what the average costs are, you can see some of the benefits and some of the payer streams, as we call them. And assisted living is predominantly private pay, okay? And that's probably where assisted living gets the rap for being more expensive, because even though the cost of care in a nursing home may be double what that same care costs in assisted living, if it's coming out of your direct bank account to pay for that versus coming from a check from the government, where do you feel that, right? So that's where when people are private paying in assisted living, that's why oftentimes people say, how do you afford that? Even though we're the most affordable care model out there right now for kind of a congregate community living. There is some long-term care insurance available, and I just read an article this morning that came through that there's actually legislation in process right now federally to create 3 optional new long-term care type of insurance, for lack of a better term, that would make long-term care options for insurance more affordable. They're recognizing that what's happened over the last several years is long-term care insurance, which a lot of people have depended on to plan for their healthcare needs, has just gotten so expensive that you can't even afford the long-term care insurance anymore. Veterans benefits. A lot of people don't know that veterans do have benefits for assisted living. You won't pay for your entire rent or lease monthly, but it does pay for a big portion. You do have to apply for that. There are Medicaid waiver programs. Almost every state has one. Tennessee has one. It's been very non-provider friendly in the state of Tennessee, and most states are that way. And what I mean by that, without getting into too much detail, is they put a lot of strings attached to this little bit of money, right? And for instance, they won't allow us as a provider to bill for room and board. And in an assisted living environment, when you're making it that nice, so much of the expense involves around your room and board. So that's one reason why you don't see very many Medicaid eligible communities in Tennessee. So prices that determine or issues that determine what an assisted living is going to cost a resident monthly are huge. It is private pay, and so much depends on even those 4 points right there. You know, for instance, I'm building this same community that I just built here in Johnson City. I'm building that in rural Kentucky, and I'm changing a few things aesthetically so I can build it more affordably, so I can meet the market demands and the price points. But here in Johnson City, it's for instance, my land cost was about 5 times what it was. So my cost of development, all those things that go into the business model, it varies greatly just depending on what piece of land you choose. Services provided, apartment sizes, amenities, all those things that are fairly common sense. So boilerplate this for you. And again, this is different per market, per state, but National Investment Center, who we turn to for most of our statistics as far as this goes in the industry, you can see the national median to be $33.26 per month. That means that's what your average resident nationwide pays for their living, and most of the time that's what their whole bill is for a certain level of care. $33.26. For that same type level of service, you can see what a nursing home the average would be, $7,000. So do I think that CMS, the Medicare, Medicaid, wants to get involved in this? Absolutely. This could be a huge savings for them, right? If they could reimburse at $3,000 to $4,000 a month versus $7,000 to $8,000 a month for the same level of care. That's a huge savings. That's a huge opportunity for us to save in our program dollars. However, common sense would also tell you what comes with CMS and the regulation, much like the Medicaid program that I just outlined to you. There's a whole lot of red tape involved. In the state of Tennessee, I was the first licensed adult daycare program in Knoxville, Tennessee, to be approved by the Medicaid program. I jumped right back out as quick as I jumped in because immediately when I found out all the reports I had to file just to get that little bit of money, I had to add a full-time extra person just to process the paperwork. So then I was losing money. So that I had to raise rates. So that unfortunately, and I'm not like a big anti-government guy, I work for the government, but that just is how it works sometimes. I'm giving you a lot of information in a quick amount of time. I see your eyes glazing over just a little bit. Hang with me. And Colin, let me know how I'm doing on my time. I told him my watch died on the way when I was walking across, so I'm stuck on a certain time.
You're at about 9:15.
Okay, good deal. So I wanted to show you just some examples. If you've never been in an assisted living community, you haven't visited grandparents, you haven't interned, you haven't volunteered, you may have no clue. Here are just some pictures that I pulled up of some of our communities. And if this will work, I actually made a little, when we first opened, I don't know if you can hit play on here, but I made a little 1-minute video so you can actually see what the inside of the community in Johnson City here looks like. So what you were seeing there was the Johnson City community. I just took that video about 4 months ago before we had many residents. And pretty nice, right? I mean, it's nicer than where I live. It's a real joy. And so our whole concept, and I think many owner-operators' concept is, I live by the philosophy, it needs to be a great place to live. It needs to be a great place to work. It needs to be where you want to go see your parents and spend time with them, and you feel good about where they're going, right? So the interesting thing is what you just saw, we care in that environment for a very frail population. Imagine an 87-year-old female. What do those typically look like? What needs do they typically have? All the incontinent issues, everything that you see there. There's so much thought that goes into these communities. Aesthetically, while that looked pleasing, most of the fabrics were non-water absorbent. They were heavy rub materials. They were things that won't absorb odors. It was all purpose built. So there's a whole industry. I don't know what backgrounds y'all all come from and where you'll end up going, but there's a whole industry now created around the design, materials, and the thought that goes into designing these communities. That's one of the things that I love the most. Last week I was sitting with an interior decorator and she was telling me all these cool things that she's putting into our new building, and it was just fascinating to me. I'm way not creative enough to do that, but some of you in this room may be, and that would be a really exciting field. Issues and trends, we've talked about the rising acuity. I kind of boilerplate it down to just a few things: legislative, regulatory, economical, and population aging. I'm sure probably a lot of those y'all already studied a lot of topics, and y'all could probably educate me some on population aging and things like that. So the aging in place model, I'm going to fast forward real quickly through these last few slides because we've already talked through some of this. The need to increase training, licensure, and certifications. This is really interesting. You may not be aware, but in the state of Tennessee, to become a licensed administrator or a certified administrator for an assisted care living facility, you only have to be 18 years old, okay? 18 years old and only either a high school education or equivalent. That's it. And you can be an administrator. You can run one of these places, theoretically, okay? That's all changing. The board that I'm part of, we just did a study to try to evaluate what other states are doing that have been a little progressive and trying to raise the bar of training and preparation for their administrators to meet the acuity. And one of the immediate changes that was recommended, we raised the age to 21. Okay, so I started as an administrator when I was 25, had no clue what I was doing. When I think back to those poor residents and that poor staff that was being led by me, it scares me to death, but we got through it. But all to say, that's a big thing. The administrators, the clinical teams, and then I also touched on the certified medication aid programming. That's a big hot button that I'm dealing with in the legislature on Wednesday. There's all these movements and laws being made and regs being made to raise the bar of entry into being able to manage and provide services in assisted living. And rightfully so. Quite honestly, the folks that we're caring for require a lot of care coordination, and it doesn't mean someone that's younger or not certified can't do it. I'm living proof of that, but it's certainly wise. CMS continues to change. Back in, Colin, you could probably speak to this, and other people are a lot better than I can, but in 2008, I saw a huge change in the industry. It's like it fast forwarded several years in the acuity spectrum. But I won't give you all the specific technical terms because I would butcher them, but there was some reimbursement changes to where basically the requirements to be eligible for a nursing home or a skilled nursing facility, CMS, they raised the bar and said, basically, you've got to almost be dead. I mean, really, you do. You got to require so much care to be eligible to be reimbursed in a nursing facility. So then what happened is all those residents that had been living there and just needed a little bit of help, they suddenly were going to have to start private paying for that care if they were going to stay there. And what happened was their price tag went from not really feeling it because Medicare, Medicaid's paying for it to, oh my gosh, the average is $7,000. I'm going to have to pay $7,000 for this care. So people couldn't afford it. So where did they go? The next level downstream, and that's assisted living. And so that was a big deal for us. You combine that with some of the economical factors that happened in 2008 with the recession, people waiting longer to come tour and move into an assisted living community because they're losing savings and they're afraid to spend money. So they wait until they have a life event, a healthcare event, and maybe a broken hip or something like that, and they have to move in. How much time I have on?
Dr. Porter, what time do we usually end? 5 till?
We usually wrap this out at 9:50 so we can have 5 to 10 minutes for
So
Q&A.
I'm there.
Yeah, you got about 5 to 10.
Okay.
About 6, 7
We'll move real quickly here. Everybody heard of ACOs, right? Y'all probably know way more about that than I do. But this is an emerging trend, and it's really impacting us kind of indirectly in assisted living. Since we're not part of the reimbursement stream officially, you know, the nursing homes and all the people that are part of the reimbursement, they're being part of the ACO. But what happened about 3 years ago, I'll give you a practical example. In one of my Knoxville communities, I tracked statistics and things, and I saw that from one of our health systems that was like our friend that we got so many referrals from, like my referral numbers were like dropping. So I went and talked with the hospital administrator and stuff. Said, what's going on there? Are we doing something wrong? And he wasn't really sure, but he had given some initiatives. And so what they started doing was tracking readmissions. And they started telling their discharge planners to only send folks to the places where they were getting the fewest readmissions from. And I did not know that, okay? And so what happened was that was all driven by reimbursement and this formulation of ACOs and things like that, and hospitals and healthcare facilities being penalized for things as simple as readmission. So that's greatly changed what we're doing as well. There's a few tools out there. I'll just stream through these. If you ever want to get on, there's a website right there I listed, Interact. That's a system. You can see interventions to reduce acute care transfers. A lot of that is like flow charts and things like that that were really developed for nursing homes, skilled nursing facilities, to when a health event happens, let's say in a nursing facility, it gave a flow chart of what to do for the clinical team, right? And the whole concept was to better assess, to do a better job rather than every time somebody fell or every time somebody had maybe a head injury or whatever happened, they were immediately sending them to the ER, to the hospital. So it's trying to do a better job of caring and assessing the situation where they are. Well, they also developed a system that not too many people have used or really looked at for assisted living, which is further lets me know that because a lot of this is somewhat sponsored by CMS, that they're trying to get their hands into assisted living as well. Economical factors, we've talked just a little bit about that, but here's one thing that I don't hear a lot of people talking about, and I see kind of this perfect storm coming, and it's seniors having less resources and assets than in previous years. When I first got in the industry, I had, grandma, grandpa, coming in, rolling in their Cadillacs, and just money bags. I'm talking, they would tell you about all this IRAs, all these savings accounts. They've been planning their whole life to retire, right? Well, what I'm seeing, and I think others are seeing, is because of just general economical factors, but just spending patterns and saving patterns, different philosophy on all that. The generation that's getting closer to my age and my parents' age, not savers. We're spenders, right? And so you're seeing that the cost of care is going up, and yet the ability to pay for that care in the population going down. So you combine that with this generation and this aging population that's coming, we've got a real problem on our hands, right? And so with that, I think that does create a lot of great opportunities for you all. You all are the future. They're going to be determining how we do a lot of this. So that's why I say your critical thinking skills are critical. Population aging, that's just a couple of little statistics I pulled up for you. You can see where older population is to more than double, from 40.3 million 2010 to 83.7 million by 2050. It's a lot of people to care for, right? So again, don't be bogged down by this. Don't feel like overwhelmed by all the information. Just know that there's so many opportunities. There's going to be so many things changing, and you're right at the point in your life and entering your career where you can be part of that positive change. So it's really exciting. How do you get involved? Real quickly, some of the things that you're probably already doing. Internships, we've already talked about that. Volunteer, so good to just go and familiarize yourself. Every community needs lots of volunteers to do everything. I mean, anything, you may not be comfortable with the clinical side of things. There's a million things you could do. Answering phones, giving tours, helping with transportation, helping with activities. There's a lot of things you can do. And then network. There are multiple, as I mentioned, Alpha is one of the predominant associations, but there's multiple, and all of them, almost all of them, have state chapters, right? I'm on the executive committee for 2 of the state boards that are member organizations, Leading Age, Alpha. And both of those, I can speak for those, we have student tracks. In other words, if you're not an administrator yet, if you're not in the industry yet, but you're wanting to get involved, you're wanting to get education, you're wanting to get resources, you're wanting to network and meet other administrators and owners, there's usually a very, very, very reduced rate for you as a student or a new person getting in where you can pay and you can still get all the education. You can go to the state conferences. You can meet employers. You can do all that kind of stuff. I'm happy to provide you that information. You can contact me directly. You can contact Colin or the members here, and they can get you my information, and I can get you involved. So that's a good thing to do. I won't go back into all this. This just tells you how to get certified and licensed. I would encourage you, though, if you ever think that you might want to be an assisted living administrator while the bar is really low, go ahead and get your license. Okay, go ahead and it's like $180. You fill out an application, you show proof of your education, and you're an administrator. Now, you're not going to get a job anywhere as an administrator, more than likely, because you're going to have some experience. But having that, it looks great on your resume, right? And from that point, you have to, in the first 2 years, you got to do CEUs. It's like 24. And it's very easy. It's pretty affordable. There's locations all over the state. You can get it, and you can get it online. Those are things that you can do, and it just starts building your resume. And it lets employers know that you're serious, that that's what you want to do. So, I think we made it. And I'm not too late.
No, you're good.
Okay, so that's it. I am happy to stay as long as you want.
Hello, everyone. We have to go to another meeting at the College of Education, but I'm with University Career Services. I want to encourage everyone here to make sure you put your resume online through our office. There's a handout at the front right here, and we help people get jobs with these college diplomas. We coach interviewing practice. We post jobs out for ETSU collected opportunities. So if you're not registered with our office, you should be. If your resume is not where you want it and you need help, you might want to contact us. The handout's there. And thank you for inviting us to also join today.
Sure, thank you.
Thank you,
for
and great presentation.
Thank you.
I didn't have a question. I just needed to tell them because I got to roll.
Thank you for joining us. And the handouts, it's a one-pager with lots of helpful information. Please pick one on your way out. But we do have a couple minutes if you have a question here, or if you'd like to talk with Mr. Crisp in the student lounge. I think he would be happy to stay with us for a few additional moments. But any questions or comments that you'd like to share with the group here before we conclude the program this morning?
Yes.
So that average rate at $3,300 a month, is that per person, or if you have like a husband and wife occupy the same space, is that discounted, or how does that be?
It's a great question. Every facility, every company does it a little bit different. So it's not that each in our community, and it's what they'll typically charge is like a nominal extra fee, and that covers most of like the cost stuff, like their food, their individual care, that kind of stuff. But no, we have a lot of married couples that live in the same apartment. And then we also have some where it gets a little bit tricky, like we even got this situation in Johnson City. We have a memory care part of our facility, and we also have an assisted living. And it seems like, unfortunately, many spouses don't age and they don't have the same issues. And so I have a couple that one lives in memory care and one lives in assisted living. What we typically do is take the higher acuity resident, set the care level and the care rate on that person, and then get the other person as affordably as we can. Something else too that depending on the community, and this is where there's a lot of opportunity for business models. We are a mission-driven but also faith-based company. So we're mission-driven and also for-profit, which is really weird. People look at me like, how can you be mission-driven and for-profit? Well, what we do is we go in and we partner with a lot of not only community organizations but churches cross-denominationally, and you'd be amazed at how much when I say Little Miss Jones, who's 93, has been a part of your congregation for her whole life, giving money, supporting the ministry. Now she's widowed, and here's the cost of care. Here's where she is. She can't afford it. I'll go to those churches, that congregation, and I'll say, here's the deal. I will split this 50-50 with you. Can you help support this widow? You'd be amazed how many times that church rallies and supports them. So there's a lot of things in our industry. Because of the way that we're regulated, we have a lot of flexibility to do unique business models. So I just wanted to throw that out there that there's a lot of creativity involved with how we would get people to have affordable care. Good question. Anybody else? Yes, sir.
Yeah, you were talking about industry regulation and you didn't mention joint commission. So is joint commission has any role in industry regulation?
No, we don't have any of that in our industry yet. So, yes, sir.
Just real quick, you had mentioned how people can get licensed, but what is really what would you suggest is a career track? How would a student get into the industry as administrator? What is compensation, average life across the state? And what's some advice in that?
Yeah. So really the advice that I would give you, and it's kind of hard to figure out, at least it was for me at this point in your life and your career, is try to find out what you're really passionate about and where you think your basic skill sets intersect. Because one, that's going to be where you're most happy long term, right? But I would advise you look at Kara, okay? Just get involved at some level. If you come out thinking that you're going to make $50,000 to $75,000 in your first job in this world, it's just more than likely not going to happen. When I started, I still had to work 2 more jobs just to do what I was doing, okay? So I will tell you, in Tennessee, and I would say like here in Johnson City, if you were overnight, you did become an administrator of somewhere like a Dominion Senior Living of Johnson City, which would be really hard to land that role without a lot of connections and other relevant experience. But you're going to be making somewhere between $55,000 and $75,000 a year as administrator. What the nursing home industry does, they have some very formulated, Colin can give you the specific term, but training in administrator and training programs. We don't require that in assisted living, but depending on the program that you get involved with, the community you get involved with, and the company, they have developed their own. For instance, Dominion Senior Living has one. Actually, Kara is on that. So she's on a program to where how we do it is much how I was trained. When I started, even when I was a licensed administrator, they didn't give me the seat and the keys to the throne right away. I had to put in some labor, and I literally worked in every department doing things I was very uncomfortable with. I had to do the Heimlich on a 92-year-old woman, in my 3rd day, and I had just learned how to do it, and I heard her ribs breaking while I was doing it, and after I did it, I went and threw up. So, I mean, you got to do some things that you're not uncomfortable with, but I knew that I was on a track. I was working for a mission-driven organization, which I was passionate about. So I don't know how to answer that specifically, Colin, other than you just got to get involved. There's no real standards in our industry, and every company's a lot different. So find an organization that you feel good about and get your foot in the door. With the growth that's occurring, kind of the sky's the limit as to what you can do in assisted living. So.
We actually have a question from an online student, and her name is Shanna Strakel, and she says, how does the Affordable Care Act affect long-term care with the emphasis being placed on preventative care?
Well, that's a great question, and we're still trying to figure all that out. Again, where we feel like we fit in is we're all about the preventative care, right? Everything we're doing is care coordination. I've already told you and shown you how we feel like we have the most affordable delivery system, but we're not really on a big federal for sure, but even a lot of times on a state level, the assisted living industry is not really being invited to the table. Okay, so we're getting to the table just because people are learning more about us and we're growing and so forth. But probably the ways that I was showing in the presentation is people are finding ways to coordinate with us to try to keep people in a setting that is more affordable longer. And around the Affordable Care Act, other legislation is creeping up all around it to try to make that happen. And then the regulatory agency, like I sit on here in Tennessee, the board, then we have to figure out how that law applies to the unique healthcare facilities and their licenses. I hope that answers the question a little bit. That's really cool that y'all got online people watching right now. I would have dressed a little nicer.
No, you're good. So I think in the interest of time, again, this concludes, the formal component of the program. A couple of quick reminders on your way out. Again, please pick up one of the flyers from Career Services. And if you have not signed in to receive credit, okay, you need to stop by the table here and sign in if you're interested in receiving a credit for attending the program this morning. Again, Mr. Crisp will be in the student lounge for a few moments if you'd like to talk with him one-on-one. And let's please give him a big round of applause. Thank you so much. I think this was fascinating. We did everything that we asked and then some more.